Hi, I'm Jennifer Howley with the New Hampshire Division of Public Health Services, and I'm a data scientist working primarily with our hospital discharge dataset. This dataset includes all people utilizing the hospitals, not just the insured. Therefore, it gives us an understanding of the health needs of our entire population. We use the data to get counts and rates of all hospitalizations and emergency department visits for many health outcomes of concern. We can look at these rates across time or across counties or communities. It gives us valuable insight to where resources and interventions are most needed. Our hospitals also use the data to better understand where service needs are being met and where there are unmet needs. We can find what communities are traveling long distances for specific services and help answer how those needs can be met in their own communities. The hospital discharge dataset does have its own unique limitations that you must be aware of when working with it. But once you know these limitations and know the advantages, there are many questions that can be answered with this valuable dataset.
This is module number 4, Unlocking the Potential of Hospital Data, Applications, Limitations, and Access. Hospital discharge data offers a wealth of information for understanding and improving healthcare systems. To truly use this data effectively, we need to understand both its strengths and its limitations. This module explores the diverse uses of HDD, highlighting its benefits and drawbacks, showcasing real-world applications, and outlining the steps involved in accessing this valuable resource. Hospital discharge data is an essential tool for analyzing healthcare trends and improving patient outcomes. It provides insights that support various public health and policy efforts. For example, hospital discharge data can provide population-level insights. One of the main benefits of HDD is that it provides insights into healthcare utilization, costs, and outcomes across entire populations. HDD also allows for trend identification. HDD allows for the tracking of healthcare trends over time, revealing shifts in utilization, costs, and patient outcomes. HDD is appropriate for performance measurement. The nature of the data allows for comparison against benchmarks and identification of areas for improvement. HDD has potential to track patients over time. In limited circumstances where states have access to consistent patient identifiers or identity resolution tools, HDD can facilitate the tracking of patients' hospital experiences over time. There is a potential for data linkage. It is also worth noting that in some cases HDD can be linked to other data sources, such as vital records, cancer registries, and all payer claims databases, to enhance research capabilities and provide a more holistic view of patient care. These data can inform policy. Policymakers and researchers can also gain valuable insights into healthcare spending patterns, cost variations across different hospitals and regions, and the financial impact of specific diseases or procedures. Let's review some important applications of hospital discharge data. First, epidemiological surveillance. Because HDD can provide population-level insights, it plays a crucial role in epidemiological surveillance. It can be used to help track infectious disease and outbreaks, monitor trends in hospitalizations, identify public health threats, and assess the burden of chronic conditions. This can help inform and evaluate needed public health interventions. The second application is quality and performance reporting. The performance measurement capability of HDD is instrumental in evaluating hospital case mix, quality, patient safety, and adherence to best practices. This includes measures like hospitalization rates for specific conditions, readmission rates, hospital-acquired infections, and mortality rates. These metrics can be used to benchmark or assess hospital quality, measure trends over time, and inform public reporting initiatives and efforts to reduce avoidable hospitalizations or improve care coordination. A third application is policy and resource planning. Trend identification capacity of HDD can allow state agencies and healthcare providers to allocate resources effectively and plan for future healthcare needs. Hospitals can use the data to analyze their own performance and identify areas for improvement. The data can also allow them to benchmark their performance against other hospitals and track progress over time. Lastly, these data are applied in health disparities research. Since the data cover full populations and can be linked to other sources, researchers analyze the data to identify inequities in healthcare access and outcomes among different populations. Hospital discharge data are used in innovative ways to address healthcare challenges. Annual hospital utilization reports provide critical data on hospital admissions, readmissions, emergency department visits, surgical procedures, patient demographics to guide public health strategies. Community health assessments get used by health agencies to evaluate hospitalization patterns, emergency department visits, and disparities in healthcare access. This data helps identify high-need areas, track preventable hospitalizations, and inform targeted interventions such as expanded primary care access, chronic disease management programs, and public health initiatives. Comparing healthcare facilities. Many states have developed public reporting tools that allow consumers to compare hospitals and facilities based on quality metrics, patient satisfaction scores, and other relevant information and make informed healthcare decisions. Interactive data query tools. In addition to empowering consumers to make informed decisions, the query tools allow users to generate custom reports, visualizations, and de-identified, aggregate data extracts to support research and policy development. Several states have developed helpful tools using HDD to help monitor public health outcomes. These portals can be used to identify communities at risk and inform public health interventions. Here are some examples that highlight how data can be made accessible and actionable for various stakeholders. New Mexico's indicator-based information system includes reports by health topic, like maternal and child health, community reports summarizing baseline conditions and trends in a community, reports for specific public health topics, like inpatient hospitalizations for asthma, and allows users to query hospital discharge data. The New Jersey State Health Assessment Data Query System is a tool that uses a similar architecture to New Mexico's system. Both tools provide access to a wide range of health data beyond hospital discharge data, including vital statistics, cancer registry, and public health survey data, like BRFSS and PRAMS. The Illinois Hospital Report Card provides consumers access to information about the quality of healthcare provided in Illinois, including quality and safety data, nurse staffing, patient satisfaction, and costs of services in hospitals and surgery centers. Additionally, many states have created supplemental environmental public health tracking portals that integrate HDD with environmental data to create public health tracking portals that monitor the impact of environmental factors on health outcomes. This data integration allows for a more comprehensive understanding of community health needs and facilitates proactive responses to environmental health threats. These tools demonstrate the power of HDD to inform public health initiatives, empower consumers, and support data-driven decision-making. Various organizations utilize hospital discharge data to guide decisions and improve public health outcomes. Let's review some of the more common users and their applications. State health agencies monitor health trends, develop prevention programs, and conduct needs assessments to inform policy decisions. Public health researchers use HDD to study disease burden, assess the effectiveness of interventions, and analyze healthcare disparities. Payers and policymakers use HDD to assess healthcare spending, shape reimbursement models, and guide policy reforms that impact patient care. Academic institutions, like universities and research centers, use HDD to study healthcare utilization, patient outcomes, and the social determinants of health. While HDD is a valuable resource, it has several limitations that must be considered when analyzing and interpreting the data. These limitations vary depending on the type of analysis. First, let's consider limitations related to the data's content. The data contain limited clinical details. HDD does not contain related clinical details, such as lab results, physician notes, or medications. This limits its value for certain types of analyses that require detailed clinical information. The data will have gaps in outpatient care. While all hospital-based encounters are generally included, HDD does not capture outpatient visits, such as visits with primary care, specialist, retail or urgent care, rehabilitation and physical therapy, and pharmacy providers. Tracking patient journeys has its limits. Sometimes hospital systems include unique patient identifiers in their submission files that allow researchers to see multiple interactions with the hospital system, but it would only apply to certain settings, like inpatient, ambulatory surgery, or emergency room care. That means that while you can look at readmissions or repeat care, any attempt to recreate a timeline of care for an individual patient based on HDD will be incomplete. Next, we'll discuss limitations related to data quality and the practicalities of data handling. There are always processing lags. As with all administrative data, there is a delay between when care is received and when the data are available in the final database. This lag is unavoidable because of the need for multiple stages of processing and validation. The lag can range from weeks to months, depending on the data collection and processing procedures. Data quality can vary across suppliers. The quality of HDD can vary depending on the supplying hospital's data collection and reporting practices, staff resources, and technical capacity. For example, there can be variability in completeness or reliability of self-reported demographic data. As mentioned earlier, some hospitals may be allowed to submit data in a less granular format or with less frequent reporting, which can also create some variability. Payer identification can be tricky. Analyses that focus on insurance coverage or access would benefit from knowing the type or identity of the person or party responsible for paying the bill. This could be a health plan or an individual. The health plan or individual payer name is often reported as text strings, and deciphering them can be challenging, especially since hospitals can use different spellings or abbreviations. Payments are not included. As discussed in Module 3, state hospital data programs only collect billed charges, not actual payments. This can complicate accurate cost analyses and economic evaluations, as billed charges often differ significantly from the actual reimbursement received by hospitals. Researchers must be cautious when drawing conclusions about healthcare costs based solely on billed charges. Despite these limitations, HDD remains a powerful tool for healthcare research and analysis. By understanding its limitations, researchers can plan their analytic designs accordingly and draw appropriate and meaningful conclusions from the data. Access to hospital discharge data varies depending on its intended use. Hospital discharge data is made available to the public in several ways. Public use datasets or public use files are de-identified state and national inpatient, emergency department, and ambulatory surgery datasets available to the public with minimal restrictions on their use. They are commonly used for public health reporting and policy analysis. However, there are prohibitions on attempting to re-identify persons in these datasets. Public reporting tools, like those in Illinois, New Jersey, and New Mexico that were mentioned earlier, provide accessible data for users to explore hospital metrics and trends. Many hospital data programs allow researchers to apply for access to more detailed data. Accessible data typically includes only the minimal necessary identifiable information, such as full dates or more granular geographic details, as determined by an institutional review board. Accessing identifiable data from an HDD typically involves navigating a formal process that varies by state. Let's consider a typical research data request process. Potential research data users generally need to do the following. Define the research question or purpose to clearly articulate the specific research question or purpose for which the data is needed. Submit a formal data request to the state agency responsible for managing the data. This request typically includes a detailed research proposal, data use plan, and information about the intended audience for the research findings. Complete any required data security training to ensure compliance with privacy regulations and data use policies. Obtain IRB approval if the research involves human subjects to ensure ethical research practices. Execute a data use agreement that outlines the terms and conditions for data access and use. And finally, pay any relevant fees states charge for data access, particularly for commercial use or large data sets. This represents the process for the most restricted access cases. The process to gain access to public use or limited datasets may be simpler and only include some of these steps. It's essential to contact the relevant state agency for guidance. In conclusion, hospital discharge data is a valuable resource for understanding and improving healthcare systems. By understanding its limitations and benefits, researchers, policymakers, and other stakeholders can leverage this data to inform public health initiatives, evaluate hospital performance, and drive improvements in patient care. As technology advances and data access improves, the potential for HDD to transform healthcare will only grow. We hope you have found this presentation on Hospital Data 101 helpful. NATO and our members are committed to supporting hospital data programs in their various forms across the country. We look forward to your participation in our various supporting programs.
This concludes today's training. I hope you've enjoyed Hospital Data 101. Please look forward to more training from NATO through our Hospital Data Initiative. Thank you.